Bismillahirrahmanirrahim. Assalamu alaikum. Today I am going to demonstrate how to inject the injection for the lateral epicondylitis. Now first of all we need to know about the landmarks. This is the point, that is the lateral epicondyle. You can confirm this by extending the elbow, and you can come from top towards the lateral aspect, and the most prominent part is your lateral epicondyle. The position of the patient's arm is that it can be adducted or it can be placed like this in a plane of scaption, and elbow should be flexed and the hand should be resting normally. You can also place a towel in front or under the hand just to relax, or you can ask your patient to put your hand like this. Now we need to understand that there are two tendons that are very important. There is extensor carpi radialis and extensor carpi ulnaris. These two are very important tendons, and the site of pain is the site for the injection. So we can ask our patient to tell us about the most painful site. Which site is the most painful? It's this one? This one. Okay, here this is the olecranon and this is the lateral epicondyle. Now the technique is that we can mark this area. This is the real site, or there can be multiple sites also. It is very similar to the injection of the elbow joint itself, where you can triangulate the radial head, the lateral epicondyle and the olecranon, but right now we are looking for the lateral epicondylitis injection. If this is one site, we can apply injection over here. If there is another site, we can apply the injections to the other sites as well. So is there any other site? This one. So this one is another site, and this is, so we have two sites. We can try to use a method which is called as Hong's method. Now in that method we can try to inject at this point and around this point. So I'll show you how I can insert the needle or withdraw the needle at the same time, and I can rotate the needle. It's totally painless procedure. There's no pain associated. It's just the pain that is with the first prick. Now the swabbing, you need to make sure that you follow aseptic maneuvers. So you can use plenty of alcohol swabs or methanol. For the preparation of injection, I am using xylocaine and I'm using dapomedrol. So the formulation is 1:1. I've used 1 cc or 1 ml of 40 milligram of dapomedrol, which is methylprednisolone, and 1 cc of xylocaine or lignocaine, which is a local anesthetic. So once you have swabbed the area, you have marked the area, the injection needs to be perpendicular. Now you can inject directly to the site, and you can feel for the point of resistance. Before that you can inject. You are going to press onto the plunger, because the elbow is like this. I should not be injecting directly like this. I should inject perpendicular to that region. Now I've injected about half cc of this into this side. Now I'm going to pull the needle and I'm going to redirect the needle. Here you can see I've redirected it and I'm injecting it. After that I can also pull and I can redirect. Similarly, I can redirect to that direction and I can redirect it to the upper side as well. If you feel resistance, you need to withdraw your needle, because you might be inserting into the tendon, and lastly we can inject directly over there. With a pop or with the locking of the syringe, we are done. Now it's a painless procedure, like I mentioned before. It's only the pain that is associated with the needle. You can use alcohol swab with that, and you can place an alcohol swab and a firm pressure onto it. After the injection, you can place some ice onto the injection site. You can ask your patient to wear an elbow brace or a tennis elbow brace. It should be worn over here, not over here, but over here. This is the site, or the site where you have maximum muscle bulk. This is the site where you need to wear the brace, and they can gradually resume the activities. I hope you liked this video. If you have any questions, do let me know. Thank you very much.